Hello, everyone. This is Blaine Cloud, the head of neurology research at Spherix, and I'm here interviewing Dr. Rob Naismith, who's one of the leading MS specialists in the world. Uh, if you don't mind, Dr. Naismith, we were both out around the AAN conference in Denver, the 2024 AAN. What were you hearing from your colleagues are the biggest takeaways in regard to advances in MS?
Well, I think at AAN and at other meetings, one of the major topics is unmet needs for progressive MS and the role of chronic inflammation and how we can either refine the current treatments or develop new treatments to better address the CNS-based chronic inflammation. So, of course, there's a lot of discussion about our current treatments with all the different B-cell depleting options that are available that work wonderfully in relapsing forms of multiple sclerosis, but progressive MS encompasses up to half the MS patients, unfortunately, and we've noticed that the medications are not effective for that cohort. So there's this concept of chronic inflammation that it's not being addressed appropriately by the monoclonal antibodies that aren't able to penetrate across the blood-brain barrier to the areas in which they need to get. So there's a lot of research looking at higher doses of monoclonal antibodies, with Roche doing an Ocrevus double and triple dose trial with CD19 CAR T cells, with the T cells being able to traffic more readily into the CNS to reach those cells of attack, and then BTK inhibitors, which has not so far looked favorable in regards to the relapsing patients, but we have upcoming data to digest in aggressive MS by Roche and Sanofi, and with frexalimab, another upcoming therapy that has anti-inflammatory properties that is hoped to target some of the CNS-bound inflammation. So I think the discussions on the unmet needs of progressive MS and how do you use our therapies to tackle this chronic inflammation. Yeah.